Brian Marmaduke was here last, and we asked Mr. Marmaduke for his help with the volunteers to do something. He got Susan Dietrich, who's a Port Royal medic. She had been on it before, and she's willing to serve again, so we're replacing someone. Mr. Marmaduke will get you the contact information. So if we can get a motion to that, we can move on with that appointment.
Mr. Chairman, I make a motion we appoint Susan Dietrich.
Second. Motion made by Mr. Seeley, seconded by Mr. Underwood. All in favor say aye.
Aye.
All opposed, nay. Motion carries unanimously. Consent agenda. Anybody like to pull anything from the consent agenda?
Mr. Chairman, I'd like to pull B and C.
B and C? Okay. Motion to approve warrants?
So moved.
Is there a second?
Second.
Motion made by Mr. Seeley, second by Mr. Akers to approve warrants. All in favor say aye.
Aye.
Motion carries unanimously. Mr. Underwood.
Yes,
B.
sir, Mr. Chairman. B, the request for expedited public hearing. I guess my concern is the expedited request. I'm just believing, is it a general process that we use, or is it really for something that should be expedited to meet the needs of the county? That's my concern.
Yeah, and I think Mr. Fincham understood that, and I had mentioned that to him earlier before he goes ahead. Previously, well, for number 7, Abundant Life, when they had their expedited request last year, their reasoning for an expedited request was to move their people from Utah here in time for school. I didn't see anything in our packet for either one of those with a real reason, other than we got 2 letters. And the letters basically said, we'd like an expedited hearing for both of those. Your response was, we really don't have a firm process, right? Because I can send you a letter, or I can put it on my application, and maybe that's something we need to kind of tighten up as a board as far as the process and procedure. But you can go ahead and explain Mr. Underwood's concern.
I understand. The letters actually do reference time frames. In the case of the State Fair, they are requesting to make changes to their plan of development, which was proffered as part of their zoning, in order to effect those changes prior to this year's State Fair. If you remember last year, with the change of ownership, there were some changes. We had a joint public hearing between the Planning Commission and the Board of Supervisors. The Farm Bureau has come back to us. I guess some of the changes they did not feel worked out last year. Location of the
Going to move to Kitty Midway.
right. So they're trying to get that in place prior to this year's State Fair. Again, the board still has to act on that zoning request, even with the expedited public hearing. The Abundant Life is the same way. Their letter, I believe, specifies that they are trying to get, assuming the board, if the board approves their request, secure that approval and all the other approvals they have to have in time for the school year beginning late August or early September of 2013. So there are timing issues that I believe are addressed in each of those letters.
And the definition of expedited public hearing is that we're going to basically schedule the Planning Commission in July and the Board of Supervisors in August or something like that, regardless of what happens? Or
that is correct. It does not guarantee or predetermine any action by either body.
It's just merely scheduling those a lot faster, because our normal process is we schedule after Planning Commission approval.
Yes, sir.
So
normally it comes to you. The board reviews the Planning Commission actions and then schedules the date for the public hearings.
Okay. And I think there's a little bit of grumbling, so I'm gonna ask Mr. Cully to put it on his agenda to have you work out a plan on, Because does it cost you more to do an expedited hearing?
No, sir, the advertising costs are the same.
Still the same?
If, for some reason, the planning commission fails to act at the meeting that it's scheduled and would otherwise be forwarded to the board, if there are additional advertising costs, those are borne by the applicant, so there's no additional cost to the county.
Ms. Akers, you had a question?
Yeah, I want to make sure that I understand, Mr. Fincham. The Planning Commission is to bring up this issue on the 19th of June, is that correct?
For both of them, I think.
I'm looking at really the,
Stay fair?
no, I'm looking at the
Yes, sir.
Adolescent Services.
The public hearings are scheduled for the 19th of June.
And so we are not taking up the issue until the 9th of July. So it's not that we are scheduling it before the Planning Commission has acted, because they're going to act one way or the other on the 19th, I would imagine.
Yes,
No, no,
sir.
no, no.
Well,
No,
it could
yeah.
be, it could possibly be deferred. The planning commission could hold a
Sure.
public hearing and they defer action on either request.
And if they defer it, then we wouldn't be able to take action on it on the 9th, and it would cause additional cost at that point.
Right.
Yes, sir. We could, in theory, hold these requests, or the board could hold consideration of these requests until your July 9th meeting, at which point in time you would have the benefit of the planning commission's recommendations, if any.
Yeah. And my point is, we are actually scheduling it before the Planning Commission has completed their action, which is our normal process. So that's the only thing. And well, obviously there were issues before in both
Understood.
cases. So having an expedited public hearing opens ourselves to other issues again, or the same ones again. That's why I'm just saying that we need to kind of tighten up the process a little bit. You know, a letter's nice, but there needs to be some real definition on the application, and we can do that.
We'd be more than happy to work on a policy for you.
I think that's good. So, okay, now you're saying we can wait until the 9th on these expedited requests?
Since the planning commission, if you wait until your July 9th meeting, you would have the benefit of possibly having a recommendation from the planning commission on one or both of these requests. At your July 9th meeting, you could then consider these requests, if you so desire, for your August board meeting.
Which is really what we're going to get anyhow. Is that okay?
Well, the only question that I would have, though, is if we were, well, first of all, my understanding, the expedited request only is to say that we're going to try to get the process done a little quicker. And I guess my thing is, if we say to these two groups that we're going to do the expedited request, that lets them know that the board has agreed to hear it, not that we're going to do anything different. Doesn't have anything to do with our decision, whether we're going to approve it or not approve it. But it does give them an opportunity to get information together and to prepare themselves a little quicker if they know that the request is going to be done in an expedited fashion. If we say that we're not going to do that, or if we hold that off, then we may delay them in whatever preparations they need. I mean, to me, I don't see what the issue is. We're not going to, it doesn't have anything to do with our decision. We're just saying to them, we're going to move this through because you have asked us to do that. Doesn't mean we're going to approve. It has nothing to do with that whatsoever.
That's kind of the point. The point is, expedited public hearing means I'm scheduling your public hearing now without any input from the Planning Commission. So that's what it is.
But we've done that.
Yep.
No, it's not whether we've done it before. I'm just stating what it means. I'm not saying that's my opinion or anything.
Right.
Right? I'm just saying that's what it means.
Mr. Chairman, if I could correct one statement that I made. Veritas is actually requesting your public hearing for the July 9th meeting.
They're actually requesting a public hearing for July.
Right.
Okay.
Their time frame
Is different than the state fair.
is different than the state fair. They're probably, about a month earlier than the state fair, so.
So again, that's the point. By approving this, we're basically saying July 9th, you're going to have a public hearing in front of the Board of Supervisors, well, not regardless, but if the Planning Commission takes action.
Yes, sir.
Okay,
This gives us the ability to do it. Doesn't say we have to do it. If the planning commission don't reach a decision, then obviously we won't have the public hearing, because the planning commission will not have made that decision.
That is
But
correct.
if they do, it gives us the opportunity to go ahead with it.
Yeah, that's really the point. My point is, I think we should charge more for expedited public hearing, which is a whole nother. That's my whole point is, I'm going to do, because now I don't have to, I would be waiting a month of reading the papers and seeing what happened in the planning commission. Now I don't have that luxury, so I have to work harder. Somebody has to pay for that. So, I mean, the board's going to decide. We just want to make sure, one, we want a policy, and one, we would like some sort of additional compensation if we have to do something like this as you work on the policy. We'll finish up. Mr. Black, you wanted to add something in the...
Yeah, I just had a question. Abundant Life Academy, let me get this straight. Abundant Life Academy is okay with a public hearing on July 9th.
They are requesting the public hearing on July 9th, and Mr. Parton just advised me that that was the State Fair's request as well.
Both are
I
July
thought theirs was a little bit later, but it's July 9th as well.
And I'm going to give you...
So July 9th would be expedited or not?
That's
That's their
very
request.
expedited.
Yes.
Yeah, it would rather be-
Because we wouldn't normally get the planning commission's action until
Right.
July 9th.
Okay, Mr. Fincham, without the expedited, I mean, according to the letters that we received, without the expedited public hearing, Abundant Life is, I think their goal is to come in the fall, early fall, correct?
That's my
And
understanding, yes,
that-
sir.
That would put them behind if we didn't do an expedited, correct?
Planning Commission, if the Planning Commission makes a recommendation at their June 19th meeting, it would come to the board for you to schedule the public hearing at your July 9th meeting. The earliest then, from that date of approval by the board, would be August 13th, that the board could have a public hearing on either of those items.
And how would this affect, for example, the state fair if we didn't do expedited? Would they be able to do what they want to do without an expedited?
They got to move things around. They need time, too.
They're requesting to relocate some of the venues during the state fair, trying to put that hat on. I think they're trying to get a sense from the board as early as possible in the process in order to effect those changes. If the board says no, then they know how to plan accordingly, and they have a longer period of time to address that. So I think it's a logistical issue either way, regardless of the application.
But Mr. Fincham, we addressed this last year, I believe.
Yes, sir.
And it just seems to me you'd have a plan and a contingency plan regardless of what this board, excuse me. I don't think an expedited public hearing is just something just to blow by in the wind. It should be for a specific need at a specific time, and they have time to do what they need to do, because we talked about this last year in terms of the kiddie rides and the movement and so forth. So that, if we're going to have processes in place, then we need processes in place. And if not, then we just need to say it's helter-skelter. That's my concern.
I understand, and I agree with Mr. Thomas. I think that's why we should look at a policy on these types of requests.
All right.
And I can tell you that I'm not necessarily against either one, is that I agreed with some of the statements by the State Fair in terms of why they wanted to move. But again, the expedited hearing is for a reason, not just put it on the agenda.
Mr. Chairman?
Now, I think we're probably ready to go ahead and decide. The one question is, both of these were last year issues. right?
Yes, sir.
I know the answer before I ask the question, but I'd like you to tell me. Why are both of these here before the year has lapsed?
You recall the Abundant Life Academy that request was denied by the board as a therapeutic healthcare facility. The board subsequently approved an amendment to the zoning ordinance creating a category for a boarding school under which application has been made for that facility. So it is consistent with the zoning category that was created by the Board of Supervisors for a boarding school.
Which means they now have a new category, so they're not a therapeutic whatever, and now a boarding school. So I take it I'm sure they're going to tell us they've changed their curriculum and all, so it's not therapeutic, it's a boarding school. That's for them. Because they said that, they now are not bound by their previous year wait period.
Yes, sir, that is correct. Totally different for the State Fair. State Fair was not denied. You have a new owner. They're working on the big picture in terms of modifications to the layout of the State Fair. So they are not now, and we're not subject to any time limits on refiling.
Because it passed, you don't have to wait a year. So that's why we have all these. Okay, okay. All right, let's just decide whether we want expedited public hearings or not. I think we've asked enough questions. B and C, motion to approve or deny would be in order.
Make a motion to approve B and C on the consent agenda.
Second.
All in favor, say aye.
Aye.
All opposed? Volume doesn't make it count more. All in favor, say aye.
Aye.
All opposed, nay.
Nay.
Nay. Division in the House, Mr. Black.
Aye.
Mr. Seeley.
Aye.
Mr. Underwood.
Nay.
Mr. Akers.
Aye.
Mr. Taylor.
Aye.
And I vote nay. The motion carries 4-2. So we're going to do expedited public hearings for the Commonwealth Fairs and for Veritas Adolescent Services. Can I do agenda item number 8 since I've got the VACORP representative here? Is that okay?
Yep. Yes.
All right, we're going to jump ahead to agenda item 8, which is really the only place we can go anyhow. Since you might want to ride back with Larry if you're here. But good to see you.
Good to see you. Good afternoon or evening. My name is Chris Carey. I'm the administrator of VACORP. I think there's some questions on the line of duty trust agreement. So to give you a little bit of background, you'll recall in 2010, the General Assembly changed a benefit provided to public safety officers. It's a benefit that had been funded through the state's general fund, the Treasury, since the early 70s, I believe. It was created for police officers that were killed in the line of duty and gradually expanded over the years to various other sectors, firefighters, EMTs, jailers, various other state parks and things like that. And it expanded into disabilities, permanent disabilities, as well as the deaths. The state, due to some funding related issues with their budget, decided in 2010 to require local governments to make an irrevocable decision effective July 1st, 2011. And the irrevocable decision was to either purchase coverage from a state program administered by VRS or to opt out and self-fund it. VACORP created a line of duty fund that went into effect on July 1st, 2011. We actually today provide fully funded line of duty benefits to more public safety personnel than anybody in the state. It's actually about 2.5 times larger than the state's program. But after and one of the complicating factors was they didn't just say you have to do this on a go-forward basis. They took $250 million in existing liabilities and they said, here. So not just go forward, but go back forever. And all of those liabilities forever are now yours. Well, it turns out that with our group, that resulted in us taking unfunded liabilities for claims that occurred prior to July 1st, 2011, and according to our actuaries, the value of those claims is somewhere around $17 million. So that is about how much we have. Well, now after they did all of this, and July 1st comes and goes, in the 2012 session, they actually added some language in, they tweaked some things a little bit, and they said you can do this through a trust. Well, we don't really care about the go-forward stuff. We're collecting enough money for that. We have our actuaries setting our rates. We are looking at the claims. We are funding for those claims. Everything's great. But the old stuff, that $17 million, well, where do we want to park that? It's got to sit somewhere. So it's got to sit on your balance sheet, or it has to sit on our balance sheet, on the pool balance sheet. Or now we have this trust arrangement. Well, we can take that $17 million and park it there. We're collecting enough money each year, in addition to funding for the future liabilities fully, we're collecting enough money each year to unwind those past liabilities. So really all we're doing through this trust arrangement is deciding where we're going to park that $17 million while we unwind it. It'll probably take the better part of 20 years, maybe longer, to fully unwind and pay those benefits for those past liability claims. And while we're doing that, we want the benefit of being able to fund for those liabilities, similar to what you would fund for, say, OPEB, if you've heard that word, the other post-employee benefits. So that's where we came up and had this trust document created. We sent the trust document out to all of the localities. Just like Caroline County, most localities over the past 3 or 4 months have been taking up this issue and acting on these trust documents. For you, you have one of those claims. So as of today, you only have one claim in this past liability zone. So you do have past liabilities that are impacted by this trust agreement. I actually didn't look at your claim individually before I came tonight. It was not really consequential, I thought. But the average cost of these claims is about $250,000. So every time we get one of these line of duty claims, we put about a $250,000 reserve on it. To put that in perspective, our average workers' compensation claim is about $3,000. Our average automobile claim is about $2,800. Our average property claim is about $4,000. Our average general liability claim is about $1,500. So for us to say that our average claim is $250,000, it's a big issue. So being able to unwind these liabilities on this balance sheet through this trust arrangement just really gives us a lot of flexibility to not tie up reserve funds in a manner that to just deal with this $17 million that's going to sit there for 20 years anyways. And the reason I say it like that is, we're returning property and liability and workers' compensation surplus to you in the form of dividends each year. So if I'm having to take $17 million of my $40 million in surplus that's yours, you own that $40 million. If I have to take that $40 million and take $17 million of it out and set it over here to tie up those liabilities or to make sure those liabilities appear to be funded, then those dividends that I'm providing to you every year of about $1.5 million, of which you're getting $10,000, $15,000, $20,000 each year, that all goes away. Because I'll have to keep, now instead of having $40 million, I'll have $23 million. I'm collecting $50 million in premium. I need that surplus just in case something bad happens. So if I've had to take that $17 million over here, all the dividends go away until those things unwind 20 years later. Why wouldn't I create the trust so I don't have to do any of that? So the state gave us the ability to do it. We didn't initially think we were going to be able to do it. It was actually kind of a gift by the General Assembly to allow us to create this trust to park these liabilities. So there's your trust agreement. So I'm happy to answer any questions. I hope that kind of gives you all of the information and background.
We still get our $10,000 a year?
I don't exactly know how much we quoted to you this year, but I think it was over that. I think it was probably 14 or 15,000.
So we still get that?
Yeah, you still
with the
get
new
that.
trust. I think that's all we care about. Any questions?
The trust question was mine, Mr. Thomas.
Yeah.
And the way it read in the resolution that we had is that the trust looked like it was going to last until there wasn't enough money and then they were going to pass it on. Just the language in the resolution that we had just looked sort of strange to me. So I'm the one that actually pulled that and said, I don't know that I understand this.
Well, I'm not an attorney, and we used attorneys to draft that trust agreement. The intent really is, when you create a trust, any money that you put in the trust, once it goes into that trust, can only be used for the benefit of satisfying those obligations in the trust. So what we have done is we've taken those claims and we're putting them into the trust, and then we're collecting enough money each year to try to fund as accurately as possible what the actual liabilities for that year are each fiscal year at a time as we draw down those reserves. The intent is not to, ultimately that one claim that happened before July 1st, 2011, that's a Caroline County claim, that claim's yours. That claim is passed off to you. It's your claim. If it's $100,000 or if it's $500,000 or if it's $2 million, that money's coming out of your pocket. That's just the way the state set that up. You can't buy insurance for it. It already happened. It happened years ago. That's just your claim. Any claim that happens after July 1st, 2011, you bought insurance for that, whether it costs $100,000 or $250,000 or $400,000. That's my claim. I'm paying that.
Okay.
But the intent is to gradually fund that over time rather than tying up. If there's confusion in the language, we would certainly we're happy to change the language to whatever makes you feel comfortable, because what we're trying to do is what I just expressed.
I was just looking for clarification because it looked like if we weren't able to fund it, we would get it back, you would hand it off to us, and you'd be done, and we were still paying the principal. And I guess that's the part that there's, to me, I'm not an attorney either, where the disconnect was.
Well, now, just to make you feel comfortable with that piece, each year we are only collecting enough money each year from you to pay the obligation for that fiscal year. So we're not collecting any more or any less than what the actual obligation for that claim is each fiscal year. So if you decide to opt out of this trust sometime in the future, which I think you have the full flexibility to do that, we have collected no more or no less than what the obligation has been up until that date. There's no way you can lose a dollar. There's not a dollar that can be lost in that transaction.
Okay.
Any other questions? Satisfied?
Yeah.
Motion to move forward?
So moved.
Second.
Motion made by Mr. Seeley, second by Mr. Akers, that we approve the VACORP Line of Duty Act Trust Agreement. Discussion. All those in favor say aye.
Aye.
All those opposed, nay. Motion carries unanimously.
Thank you
Chris,
very much.
as always, good seeing you.
Thank you. Good seeing you. Have a good evening.
All right, take care. What, do you want to take a 10, 15-minute break? It's 7:19? Okay. All right, we will reconvene in about 15 minutes. Gentlemen, we'll reconvene the June 11th meeting of the Board of Supervisors. This time, or close to 7:30 as possible, we offer citizens of the county a chance to make public comment. In the public comment section, we will allow groups to make presentations, or individuals. Your time limit is usually limited to 3 minutes. And you have the ability to talk about anything that is not a public hearing being discussed tonight. So at this point in time, with perfect timing, I will open the public comment section. Is there anyone who would like to speak for public comments? Please come forward, state your name, and if possible, your voting district.
Good evening, Mr. Chairman and fellow members of the board. My name is Linda Upshaw. I reside in the Port Royal District, and I am a lifelong citizen of Caroline County. I'm also a former school nurse in Caroline County Public Schools. Come to you tonight for two reasons. I wanted to sound the alarm, let the board and the public know that our award-winning children's dental program has been suddenly cut. Our program is located in the health department, and as of last week, the area health director, Dr. Rossheim, announced that it was due to close on July 30th. No negotiation, no discussion. He's also closing all three of the dental clinics, Caroline included, but also Spotsylvania and one in Stafford. Our dental clinic was a real community effort to start. We worked on a grant from late 2001. We won the wonderful grant, $80,000 from the Virginia Healthcare Foundation, and we opened our clinic in 2003. We've had 10 years of success, and now they want to pull the plug on a wonderful program. Currently, we are serving almost 600 children. Where will these children go, is my question, if we lose this program. When I was a school nurse, before we had any dental clinic here, it was heartbreaking to see the children come to the clinic with decay down to the gums or black teeth, with just horrible, and they're in pain, and these children just cannot learn when they're sitting in class in pain. At that time, our only recourse was to send them home, give the mother a phone number to the MCV dental clinic, and just say, here, they take Medicaid here. We have nothing here in Caroline. Now, if our children are having a pain, even an emergency, we can get them into the dental clinic. Our school system provides a car and driver that comes to each school and transports the children. And the children at Bowling Green Primary are right next door. Next year it will be 800 children right next door, and they just walk with an adult over to the clinic. They're very accessible. And the transportation part is what makes this program such a success. It's different from the others in the area because we have the transportation that our parents often lack due to life circumstances. They can't always take off from their job and lose that paycheck for the day. So with parent permission, our school system provides the transportation. We work closely with social services. In fact, Cynthia Green wanted to be here tonight and could not be here, but she's very much on top of this. She served on the committee. To get this grant, we started a committee with representatives from the school system, social services, Mr. Percy Ashcraft, who was here as administrator at the time, and the health department, Dr. Stern, he was the health department medical director at the time, and he led the charge and was able to get this. I did send an email out to everyone just so you knew what was going on. My object was to get this out into the public because time is of the essence right now. The other thing I wanted to talk to you about is to urge you to meet with Dr. Rossheim and ask him to slow down the process. We need time to look at other entities. If we have to reorganize, if the health department is pulling out completely, we need to find somebody to be under their umbrella. Very importantly, we don't want them to remove the dental clinic, dental equipment or the supplies that we currently have because they are priceless right now. And we need them to leave them there until we can find out and get together with other community members because we just need more time. I really think Dr. Rossheim owes the board and the community an explanation of why he's eliminating such a valuable and a really necessary program for our children. We are not in serious default. We are currently only about $36,000 shortfall for the current fiscal year. So it's not like we're hundreds of thousands of dollars in the hole. So, and pretty much all of their income comes from the Medicaid payments. And we have lots more children here in the county that are still underserved. We need to get them in too. So I do have some figures to hand you that may give you some idea of what we have to work with. But I just wanted to come and address this and just say that the children of Caroline deserve better than having the doors closed in their faces. And I just ask anyone here who's also here in support to stand up if they would.
That's fine. The folks that are here, the dentist and that young man there, I understand is a patient. So if I could see that far, I'd ask him to smile, but I already saw him close, so he's doing great. If Mrs. Upshaw, if you want to pass that to Mr. Parton.
I will.
And as soon as we finish the public comment section, we're going to address this.
Okay. I appreciate anything you can do, really do. This is something that tears at my heartstrings. It was so wonderful to get this program going. I just hate to lose it. Thank you.
Thank you. Is there anyone else who would like to speak as part of the public comment section? If you would, please come forward to state your name, your voting district.
My name is Mary Andrews. I live in Bowling Green, and I thank you all for hearing me tonight. This is my grandson, Matthew, and I have to say that the program works as well as Ms. Upshaw has indicated. It is wonderful. Dr. Barrett has done some extensive work on Matthew, and he falls asleep in the chair under her hands. She really is a great dentist, and she's turned around the dental health and general health of our children, and we just would all hate to see this program. And this is one of the things that makes Bowling Green, makes Caroline County a great place, a model city. We offer so much, and we care so much about our children and the citizens, and we hope, I already thank you for what you've already accomplished in this regard, and I'm here to help the fight, and I will stand with all of you. If there's anything you need for citizens to do, I'm ready to do it. Thank you very much.
Thank you, Mrs. Andrews. Is there anyone else who would like to speak during the public comment section? If you would, please come forward. Okay. If you wait till you get to the mic,
okay,
and then say your name.
My name is Erin Van Genhoven. I live in Woodford, Virginia, in the Upper Caroline voting district. And just as a parent, when I found this out, I was mortified. I was so upset. Matthew went in there for the first time with 8 cavities. Since then, and since all the work they've done on him, he does not have cavities anymore. He can't wait to go to the dentist, which I don't even understand, but that's good for him, and that's good for the program. He loves it. He sees Dr. Barrett, he gets excited. I've seen lots of kids, all different ages, through my church, just through living in the county. I see their names on the walls in the office, and I think that it's just such pride that they should take with that program, because they've done a great service, and I would really hate to see it go. It would be such a disservice. With unhealthy teeth, you have unhealthy kids. And that's all I'd like to say.
Thank you very much. Oh, before you go, could you spell Vanderhagen, please?
Oh, okay. V-A-N, space, capital G-I-N, H-O-V-E-N.
Thank you very
All right,
much.
thank you.
Is there anyone else who would like to speak as part of the public comment section? Is there anyone else who would like to speak as part of the public comment section? Is there anyone else who would like to speak as part of the public comment section? Hearing none, we'll declare the public comment section closed. Just for those who just came about the dental program, when we started our board meeting and part of board comments was to bring this up. We were notified, I think, Thursday, and it's our first meeting since then, so we've done quite a bit. Mr. Seeley, I believe, has contacted our state delegates to make sure we can keep the equipment. We've directed Mr. Culley, the county administrator, to get in touch with the director so that we can try to maintain the program. And I understand from talking to you, we were probably $30-some thousand short for funding this year. So I think it may help if the board is willing to find that $30,000 somewhere in their budget pending the continuation